So the first thing we're going to do is we're going to correct the pelvic tilt in the patient. And again, correction of the pelvic tilt will normalize the angle in the pelvis, and that in itself will help to take pressure off of the lower back, help take pressure off the sacroiliac joint, help to take pressure off the piriformis, and hopefully help to reduce the sciatica. Now, because the patient has such significant pronation when she walks, which contributes to the pelvic tilt and twisting of the leg, we're going to inject the spring ligament. And the spring ligament supports the arch. And because her arch is so bad, we're going to use PRP into this region. And we're going to inject the ligament of the ankle also with PRP. Again, you may ask, why would you inject the left foot of a patient who has back pain and sciatic pain down the right leg? Well, it has to do with correcting biomechanics. Because if you don't correct the biomechanics and make her pelvic tilt even, then any treatment that you do on the back is not going to work well. So we've already used antiseptic on the patient, and now we're going to basically inject into the facets and transverse processes. Again, if you know your anatomy, you do not need fluoroscopy or ultrasound. You can pinpoint these spots and you can feel exactly where you need to be with the tip of your needle and get right into the portions that you need to of the joint. And sometimes you need to treat on the left side as well when a patient has a right-sided problem, because you need stability. You need to think about the structure, not just the pain. So these are the L5, S1 regions, and we did L4 as well. And here again, as I mentioned, we have the connections to the iliolumbar ligament, which come from L3, L4, and L5. And the iliolumbar ligament is deep here at the top of the pelvis. Inject its insertion into the bone. Again, we use PRP for this, because it's really one of the best things to use. To create tissue regeneration and tissue rebuilding using the natural growth factors of the body. So here we have injections of the sacroiliac joint and the entire sacral ligament structures. And we're going to move our needle all the way down until we get to the SI joint. Now, these procedures are generally really well tolerated. Sometimes when you inject around an area called the PSIS and around the sacral ligaments, patients may experience a little bit of a zapping sensation, but this is normal. And again, it's very quick. It's necessary to treat this area. As I mentioned before, there's a region here called the piriformis, which can send pain down the leg, send sciatic pain. We're going to inject the insertion of it here. And we're going to inject the origin of it into the hip. We're going to inject along the posterior sacral ligaments. Again, we only have to put one needle stick in, and we can move the needle and inject many, many points for treatment. Here we have our hip flexors, common origin here. And a lot of these fibers blend in with the gluteal fibers. And here we have injections as well. These injections are going along the border of the hip, along what's called the iliac crest, which is the area in the back where maybe you put your hands along your waist. If you reach back a little bit further, this is where we are treating now. And again, we need to rebuild the entire structure of not only the back, but everything that supports the back. And that was the treatment of the lower back, sacrum, pelvis, piriformis, and treatment for the leg length discrepancy.